Ready?
Mm-hmm.
You're called to a local high school for possible hemorrhage. Upon arrival, you're escorted by the principal to a girl's restroom where you find a teacher sitting on the floor holding a crying 14-year-old girl while a second teacher holds a bloody towel over a wound to the girl's left wrist. A broken piece of glass is lying on the floor covered in blood. You observe approximately 300 milliliters of bright red blood on the floor. The teacher holding pressure informs you that the girl was found about 10 minutes prior to your arrival by a classmate. There's an approximate 3-inch laceration over the teenager's left wrist.
Okay. Have my proper PPE. Is my scene safe?
Yes.
Mechanism of injury.
Self-inflicted laceration.
Number of patients.
1.
And our would probably call ALS and probably not initiate C-spine. Just because probably would keep her in a position of comfort. And
I hate boys.
General impression is that we have a 14-year-old girl with a laceration on her left wrist. She's very distressed right now. What's her responsiveness?
She is responsive and answers questions appropriately.
Okay. And chief complaint?
3-inch laceration to the left wrist.
Okay. I'm going to go ahead and make sure her airway is clear. Making sure she's breathing properly. How's her airway?
Open and patent.
Okay, so probably don't need to insert an adjunct or anything. And she's also awake, so wouldn't do that. Check her breathing. I'm going to listen to your lungs. Okay. How's my lung sounds? Is my good chest rise and fall?
Normal rate and volume, adequate symmetrical rise and fall of the chest. Lung sounds are clear bilaterally. SpO2 is 98%.
Okay. I'm going to go ahead. She has major bleeding on her left wrist, so we want to keep pressure on that towel. Sorry for touching you. Put a tourniquet on their right below their elbow, making sure it's good and tight. And I'm going to go ahead and continue with my assessment. I want to make sure we control the bleeding. I'm going to, how's her skin color and condition?
Warm, pink, and dry.
And how's her pulse?
Radial pulse, rapid and strong.
Good. That's perfect. I'm going to go ahead and take her blood pressure. Okay, I'll lift her up. Thank you. Perfect. Twist this. Sorry, I need this. Oh, that works. Okay, 80 over 142.
114 over 72.
Okay. I'm going to go ahead and check her pulse. Okay, my respirations are 16 and my pulse is 101.
Respiration 16, pulse 104.
Okay, signs and symptoms?
Bright red blood observed on a towel covering the left wrist.
Does my patient have any allergies?
None.
Medications they could be taking?
Prozac for depression.
Okay. Current and past medical history?
Depression.
Last oral intake?
Lunch approximately 1 hour ago.
And then the events leading up to this?
Breakup with her boyfriend at lunch.
Alright, I'm going to go ahead and start palpating from head to toe assessment. I'm going to go ahead and, oh, sorry, is that shocking? Going ahead and check both ears, check her eyes, nose, and the mouth. Making sure there's no blood or cerebral spine fluid flowing out from any of those regions, and making sure the pupils are good and equal. How's my head?
No injuries noted.
Okay. Gonna check the cervical spine, checking any jugular vein distension, and if the trachea is also distended at all.
No JVD, no tracheal shift.
Okay. We're gonna go ahead and palpate the chest. I'm just gonna move your arm a little bit. Okay, palpating the chest. Okay. Checking, palpating the chest. Would also oscillate and inspect it. In the head of myself. Okay. How's my chest?
No injuries noted.
Okay, we're gonna go ahead and check the abdomen, making note of all 4 quadrants, palpating it, and checking the pelvis, and how is the abdomen, pelvis, and groin region.
Stable pelvis, abdomen soft and non-tender in all 4 quadrants, no genital injury.
Okay, I'm gonna go ahead and palpate the arms. Okay, palpating, inspecting it. We're gonna make any, check their motor functions. Can you wiggle your fingers? And what finger am I holding?
Middle.
Okay, we're gonna go ahead and do the other side. Check it. We're gonna make note of not to touch the lower arm. And can you try to wiggle your fingers for me? Perfect. What finger am I holding?
Middle.
Okay. How are my arms?
Pulse, motor function, and sensory function present in all 4 extremities. No other injuries other than previously described.
Okay. That's it for all 4. Okay, we're just gonna go ahead and do the legs really quick.
Oh, yeah.
Palpating, inspecting it. Palpating, inspecting the other leg. Can you wiggle both your toes? Perfect. What toe am I holding?
Big toe.
What toe am I holding?
Oh, middle toe.
Okay. Sorry, that was a hard one. We're gonna go ahead and palpate the back and check it. Okay. Palpating and inspecting the back, checking the spine. Okay, and the buttocks. How's my back and buttocks?
No injuries noted.
Okay, go ahead and lay down. This patient has a tourniquet. We're going to keep applying pressure. This is a media transport, so we want to get her to the hospital as soon as possible, making sure she is comfortable and calming her down as we get there. Also making sure parents know. Be really bad if they didn't know about this. And making sure to take note and reassess every 5 minutes and recheck her vitals. That's it.
Oh.